stammering can be said as a layman term for the professional term stuttering. Public might think that stuttering is a very serious problem. It cannot be treated at all in the life. Or the stuttering person might themselves think that it's not a big problem at all. Whenever there's an interview or a complicated situation, then I will think of how to avoid speaking to that particular person and manage this stuttering for some time. We need to understand that this stuttering is not a single issue and not a manageable issue at that particular situation. It could be a neurological stuttering which might hinder their confidence levels and speaking skills, and it could be a simple stuttering which is an imitation. When they do it during their childhood, they have imitated some person and they just adopted that kind of speech in their lifestyle. So whatever it is, whether it's a severe, mild, profound, these kind of categories stuttering can be treated by a speech language pathologist by themselves. Okay? And this stuttering problem can be identified much early, especially in children during the school ages when they give the speech to read on the stage or to the mic. They might be finding it a little difficult to address that particular problem with so many people around them. And parents themselves will come at around 4 years of age and say that he used to speak very well, but now when he's started saying sentences, he's repeating at every word, or he's giving a lot of pause between two words. So these kind of characteristics or these kind of symptoms can be identified much early and can be addressed by assessing it. So how do a speech therapists assess this problem? We have many kind of speech tests which we can check on those questions, and by the parent can answer those questions and we can see if it's a mild problem, severe problem or a profound problem. And depending on the characteristics of the stuttering itself, we can identify that okay, this can be neurological or just a limitation of an opposite person. And sometimes children might show this as a normal non-fluency. What is normal non-fluency is by 4 years, when the child is achieving the sentence level, there will be difficulty in identifying the words and grammar of it. So that's why they might repeat the words or give pauses between the words. But by 5 years or 5.5 years, this normal non-fluency can be overcome by the child by themselves. In case this repetition and pauses or finding difficulty, word finding difficulty is persisting even after 5 years of age, that can be addressed and identified as a proper stuttering. So in case it is genetic, that is within the family, it can be neurogenic also. But whatever the categories of stuttering, you need to understand that it can be treated. Either it can be treated by techniques or just by changing the style of the speech, or it can be even treated by counseling and a little bit of hypnotic therapies as such. But you can get come out of stammering much easily if it can be identified much earlier. So who can be involved in this is definitely a speech therapist can help you. You can go for a psychologist in case of the confidence levels or confidence is missing and you are into depression. A psychologist also can help you. But get it treated at much earlier stage and do not wait for it to go by itself, or wait for the situations to arise and then get it treated.